They want their costs to go down. They thought that the whole reason why we were doing this health care bill was to address the skyrocketing cost of health care, up 130% on average over the past 10 years. But what we find out with this bill is not only does it lower the cost of health insurance for Americans, some Americans are going to have to pay more. So why would we undertake this huge enterprise of creating a $1 trillion new program, multi-trillion over time, a program that cuts $500 billion out of health care for seniors, raises taxes by $500 billion? Why would we undertake all of that if we weren't going to reduce the cost of health insurance for most Americans? That's what they think we're doing here. They don't think that we're creating some grand new entitlement program. They don't want us to do that. They want us to lower the cost. So Republicans have put forward proposals, and some of them my colleague just mentioned, allowing insurance companies to sell across state lines, trying to get rid of junk lawsuits. My wife, Mikey, is pregnant with our 4th child. She goes and sees her doctor in Tallahassee, Florida, not a big town. He's paying $120,000 a year in medical malpractice insurance. That affects not only the cost of care, but it also creates this defensive medicine, which runs up costs. We've got some real concrete step-by-step solutions on our side of the aisle that will make things better and reduce the cost of health care. One thing that I've had the privilege of working on with Dr. Coburn is this idea of going after waste, fraud, and abuse. In the Medicare system, we know that there is $60 billion a year, $60 billion in waste, fraud, and abuse. My state, Florida, unfortunately, is the capital of this health care fraud. I'll give you one statistic, Madam President, that is really, I think, says it all. In Miami-Dade County, we have 7% of the country's AIDS population. Yet reimbursements for health care for AIDS patients in Miami-Dade County constitutes 83% of what's spent in the entire country. Now, why is that? It's because folks are committing fraud on the system. Healthcare providers in warehouses and strip shopping centers or non-existent offices at all. And they're not providers, they're just scam artists. Running the codes, running these medical codes and submitting them to Medicare and Medicaid. And billions of dollars are being lost. Why shouldn't the first thing we do is fix the system we have? Stop this bleeding of billions of dollars and put it back into Medicare and Medicaid, which are programs that are going broke. The president is right. There is a health care emergency in this country, and the number one emergency is Medicare and Medicaid, not creating a new program. We should make sure that Medicare for seniors is viable. We should stop the waste, fraud, and abuse and get the money back in Medicare, and then we should do the same thing for Medicaid. And once we've got those programs more solvent and we meet the commitments we've already made, then we could take the step-by-step approach on trying to provide lower-cost health insurance for people who have it and more access for people who don't. So we have offered solutions, but as we understand it, what's going to happen is they're going to take the Senate bill that was passed on a party line vote here in December on Christmas Eve, send it over to the House, and then try to convince the House Democrats that they're going to have a makeup bill that's going to fix their problems, and try to send that over here and make us vote on that on a simple majority, which is not what was intended by the rules. So I'm new here to the United States Senate, so I want to defer to my colleagues, and perhaps the senator from Oklahoma can speak to this and whether or not that's the appropriate thing to do, and also speak to the good step-by-step measures that we have to combat the problems with health care.
Well, I thank my colleague from